Hey guys, it's So Fashion Week TV, and today's video is going to be with regards to VSG surgery. So as you guys know, I am tentatively scheduled to have my VSG surgery on October 7th, 2016, and I wanted to come on here and let you guys know about the clinical information that would be required at least 12 months prior to you having surgery. So if you're interested in knowing that information, you're going to want to keep on watching. So the first thing you are going to need is documentation of participation in a conservative non-surgical weight loss program. So that would be something like a Weight Watchers, Jenny Craig, Slim Fast, any of those types of diets. And most surgeons' offices will have like a worksheet where you can write down the program that you were on, the length of time you were on it, and the number of pounds that you lost. You would essentially document that on a worksheet and sign off on it, and that's it. So that's step one. The next thing that you are going to need would be a psychological evaluation that would either be with a psychologist or a psychiatrist. Now, I know a lot of people may be apprehensive about utilizing their mental health benefits. They may think that they're crazy, or it's kind of taboo in certain cultures. I'm not sure why, but I can completely reassure you that once you go and you speak to a psychiatrist or a psychologist, it's a completely normal process, and you may actually feel extremely comfortable with allowing them in and letting them know about some of the things that you're battling with. In my most recent session with the psychologist, he made me feel very comfortable, and I am also even thinking about continuing on with some sessions with him even after my surgery, just to kind of keep my mind clear and to keep me on the path to a successful weight loss. The next thing that your insurance may require is that you go in for a preoperative bariatric education class. Now, I am here in New Jersey, Bergen County, so I went for my preoperative class at Hackensack University Medical Center, and there was a charge for that course of $60. Now, upon paying the $60 fee, they're going to give you a receipt, but it's kind of written out in a letter form, just as proof that you did attend that class. It is very important that you keep a copy of that receipt so that you can have your case manager to file that with your records. The next thing that your insurance may require is that you get a nutritional evaluation with a licensed nutritionist. Now, most bariatric surgeons may have a nutritionist on site, so it would be helpful to you to find out if that nutritionist is participating with your insurance and see the nutritionist right there on site, because they'll be able to document that you did do that, and that'll be over and done with. So if you have a comorbidity, and that would be something like high blood pressure, diabetes, sleep apnea, your insurance may require that you get a medical necessity letter from your primary care physician. And if your BMI is below 40, you definitely have to have a comorbidity in order to be approved for surgery. So that is why your primary care physician would need to produce that letter. If your BMI is over 40, your insurance may not require that letter from your primary care physician. You also need a medical clearance from your primary care physician, so keep that in mind as well. And if these requirements are not met within at least 2 weeks prior to the date of your surgery, you can rest assured that your surgery will probably be canceled or rescheduled until you can provide this information. So I hope that you guys have found this video somewhat helpful. I know when I initially sought out to have weight loss surgery, I was all over the internet trying to find information on what I potentially needed to have this surgery done. So it was helpful when I did jump on YouTube and find other weight loss surgery patients who were able to provide this information. So hope you guys have found this information helpful. Please be sure to rate, comment, and subscribe to this video, and I will see you in the next one. Bye, guys.